So good afternoon, everyone. Welcome to the Live Longer Better in Hertfordshire Masterclass. This is all about getting active with long-term health conditions. My name is Charlotte Bird, and I'm the Active Ageing Officer at Herts Sport and Physical Activity Partnership. And that means that I work on Live Longer Better in Hertfordshire. And essentially, we're here to try and get as many people as active as possible, but also recognise that sometimes if you're living with a long-term health condition, that could be daunting because you don't want to aggravate any symptoms, and there's quite a few barriers that can be in your way. So we are really fortunate to be joined by We Are Undefeatable today, who are going to be sharing some of the key findings of their most recent reports, which are going to break down those barriers and demystify getting active living with long-term health conditions. So a little bit of webinar housekeeping just before I hand over to Peter. So this is a Teams webinar, which may or may not be familiar to some people. This is not that familiar to me. So forgive me if we have any technical difficulties, but just be assured at the moment, all your cameras and your microphones are switched off, and they will be that way throughout the webinar. So if you wanted to make a comment or say hello, please use the chat function. It would be lovely if you could introduce yourselves, your name, where you're from, what you work on, why this is important to you. It'd be really lovely to get to know some of you in the chat. If you have any questions throughout the webinar, please pop them in the Q&A function, which is next to the chat function. We'll try and answer everything on the webinar today. If we don't get round to your question, we'll drop you an email afterwards. So the webinar is being recorded. We're going to share it with everyone who registered, because I know there's a few people who couldn't make it live today, but it will also be on the Live Longer Better in Hertfordshire website. And at the very end of the webinar, I'm going to give you all the link to fill in our feedback form, and that is going to help us shape future Live Longer Better Masterclass webinars, because we really want to build upon what our network would find useful to know about. One of those being, how do we support people who are living with long-term health conditions to be active? So I would like to hand over to Peter Dutton, who is the Activation Manager of We're Undefeatable campaign, and he is going to talk to us about the work that him and his team are doing, and share some really useful information. So thank you, Peter, for joining us. Really appreciate your time, and take it away.
Super. Thank you, Charlotte. And yeah, thank you for having me. What I'll do, I'll try and share my slides. What I'm going to talk through today. But yeah, I guess in a nutshell, it's great to carry on the We're Undefeatable in Hertfordshire work as part of the Live Longer Better in Hertfordshire revolution that I've seen such great work going on, especially recently with the event a few weeks ago. So it's great to be building upon that. And yeah, I'm here today to share a little bit about what We're Undefeatable is, but then also I'll share a little bit of information around some of our resources that might be really useful as well. And we'll be going through our latest insights and research from the Bridging the Gap report. Now, the sharing isn't working for me, so bear with me 1 second while I try and get this to do what it should do. See him. Good stuff. It's still working it out on mine. So, but I'm glad you can see them, but I can't see anything to click through just yet. But hopefully it'll work.
I've got the opening slide up, Peter, that says getting active for long-term health conditions with the yellow bottom half of the slide. Is it still whirring your end?
Yes, it's just thinking about it, but it's just started to load up now. So that's good news. Great. Otherwise I wouldn't know where I'm at. But yeah, thank you. So what I'll start with is just sharing a little bit about what We're Undefeatable is. Hopefully some of you have heard about We're Undefeatable before, but if not, then I'll give a quick summary and give you a feel for everything that the campaign's all about. So We're Undefeatable is a movement supporting people with a range of long-term health conditions to be active, and it's developed by 15 health and social care charities that come together that you can see on the bottom of the screen there. Hopefully some of those that you'll recognise and may even work with across Hertfordshire, as many of them have local branches too. And the idea behind the campaign is to provide inspiration through real life storytelling of people living with long-term health conditions and how they then find their way to move. And that's a lot about what We're Undefeatable and what today's session is going to be about as well, in terms of the insights we're going to talk through. We're going to really focus on the lived experiences of people living with long-term health conditions, but then also to get some of the perceptions of those who support them too. We've got a range of resources and tools available that you can utilize, that you can embed. They're ready-made, ready to go, whether it's from marketing material that you can utilize on your social media or comms channels, or there's lots on there that can actually support people living with long-term health conditions to be active too. So the best way to tell you exactly what We're Undefeatable is all about is to play a video. So I'm going to do that next, and hopefully this will all come through okay.
I need someone in the chat to confirm that we can see it, because I have stopped seeing stuff my end, and I've messaged my colleague and I've not heard back yet whether they're showing or not. Ben, would you pop in the chat whether you can see the video, please? Oh, everyone can see. Oh, someone can see in here, someone can't see anything. That's going well. No, someone else can't see.
Oh
Someone
no,
can.
that's a shame.
It's a real mixed bag in here, Peter. Some people can see, some
Yeah,
people can't.
quite a few that can. What I'll do is, should I try and start from the start of it again? I'll go back a slide and see. Hopefully people can see the slides in general. Get a few more icons.
I'll let everyone know we did actually do a tech rehearsal before this. It worked fine, so it's typical. Okay,
let's give it
a go. Thank you.
There we go. So hopefully as many as possible could see the video. I'll share a link as well to all of our stories. We've got over 30 campaign stories now, covering a range of different health conditions, people from different backgrounds, different parts of England and the UK. And yeah, I wanted to share Christine's because she has quite a wide range of different activities, but also lives with multiple health conditions, which is a huge part of what we do as a campaign. There's many people who are living with one long-term health condition who, by the data and the insights, are less likely to be inactive. They're actually, people living with a health condition are 2 times as likely to be inactive compared to someone without a long-term health condition. And as people have multiple impairments or multiple conditions, then their inactivity levels drop even further. And I guess what we try to do as the campaign is to really harness, and we don't shy away from the challenges and the symptoms and how people feel about living with their long-term health condition and the impact it's had on their life. And I think Christine's story is a real key part of showing that. But then what we always try to do is have that very positive spin on how then physical activity and moving more is supporting that person to be more physically active as well. And the idea is that then that will inspire other people living with Parkinson's or living with cancer to be physically active, to show different ways that you can be active. And this ranges from Christine doing Nordic walking to people being active at home. It can be a range of different things. As long as it's moving more in a way that works for that person and their condition, then that's all about We're Undefeatable. So just to shine a little light on why we do what we do and how we help to try and change the narrative. What we found is that 74% of people say they can relate to people in the campaign and our advertising, which shows really good relatability, shows that we've got a good range of people from different backgrounds, from different areas, and also with different health conditions too. 88% say it shows that people with health conditions can do physical activity. It shows how doing more physical activity can enable people to enjoy life in more ways, which is really important. It's not all about just feeling fitter or, you know, improvements to physical health and fitness that we'll talk about later. It's also about how this can support someone's overall health and well-being, whether that's mental health and well-being, social health and well-being, and how that all contributes to a person's life and how they can enjoy that. And also it makes people think differently about what counts as exercise. And even the word exercise, we tend not to use as much anymore. You'll hear more around moving more and movement, or even physical activity, because exercise and language around fitness can be quite worrying and can be a bit of a deterrent for people who are living with long-term health conditions. So that tends to be a similar feel to how we do things. And all of this is why we want to try and encourage other organisations and professionals to get involved with We're Undefeatable, because there's lots that you can do to inspire people living with health conditions too. So what I'm going to talk through today is our Bridging the Gap report that Charlotte really helpfully mentioned earlier. And we launched this report in April this year, so hopefully some of you may have seen it. If not, we'll be bringing it to you today, and some of the key insights that we found. And what we've looked to do today is look at data specifically for the East of England. So we're looking at regional data today to try and narrow it down to people in this area. If we go any further towards looking at Hertfordshire cut, the sample gets a lot smaller. So we thought looking at the East of England will give a really fair reflection of the sample that are hopefully people living with long-term health conditions in this area, but then also those who support them too. So just a bit about the report. This was based on a public consultation from last year in September 2023. We had over 1,000 people living with long-term health conditions who took part in the consultation, and then the rest were family, friends and carers, and a range of different health professionals or professionals from different sectors across the board. And what you'll see in brackets today is where we have the sample that represents the East of England responses for this, and that's what we'll delve into a little bit more today. After this, feel free to take a look at the full report or the exec summary. And also we have a new data dashboard as well. So if anyone wants to take a deeper dive into a particular target group, or if you're looking to look at East of England data in more specifics for, let's say, healthcare professionals or people with health conditions, then please do take a little look, have a little play with it, see what you think, because it's all about finding the insights and research that's relevant for you and the work that you're doing. So to get us started, what I guess is a key thing to share is that almost everybody knows it's key for people with long-term health conditions to be physically active. Even people living with long-term health conditions themselves, 96% of people have said that they agree that physical activity is important in managing or preventing long-term conditions. Same for family, friends and carers. Health and social care professionals at 100%, same with charity and voluntary sector professionals. And I guess the reason we want to share this is that we know that people know that it's important for people with health conditions to be active, but there is still there's a big gap in that activity levels that we mentioned earlier. And it's more about the how and how we can then support people to be more active when they're living with a long-term health condition, to make sure that it's suitable for them, to make sure that it motivates them, and hopefully it's something that they can take up, but then, you know, adhere to for the rest of their lives, to hopefully prevent future health conditions that may occur, or to manage the health conditions that they're currently living with too. So a really good place to start is always the motivations expressed for being active. And what we found across the board was that physical health and fitness was the biggest or highest reported motivator for people living with long-term health conditions for being active. So you can see some quotes there around to be healthier for my kids. Someone's mentioning staying active also ensures sleep rhythm remains consistent. So you can see that what counts as physical health and fitness differs from one person to another, but that was a key theme that come through. Second up was directly linked to a person's long-term health condition. So motivations expressed for being active then looked at managing symptoms. So people talking about, I exercise regularly to prevent flare-ups with my fibromyalgia and osteoarthritis, to try and manage my back issues and prevent them getting worse. So lots of people actually saying, I live with a long-term health condition, but I'm motivated to be active because of the way that it can support me in managing my symptoms. And then the third one is around mental health and well-being as well. People mentioning that it's a great way for them to clear their head when they're being active. Also a way of controlling their endorphins, which help with their mood and their mental health and well-being. So a really broad range, but they're the three key groups that came through within the insights that we gathered. And it's useful for us to know, because then we can hopefully think about ways to motivate people, whether that's in our health promotion or how we talk about physical activity for people with long-term health conditions. And one really interesting piece of insight that came through is that the NHS healthcare professionals, or a healthcare professional that is the person's GP, are still the most trusted source of physical activity advice and information. So even if you look at fourth down on the list, health or physical activity organisations or charities that are likely to be the types of professionals and organisations on this call, who potentially specifically work and have qualifications in physical activity and long-term conditions, there's still so much more trust in the healthcare system and within healthcare professionals. And I think that's a really important thing for us to mention. One, for how then the importance of healthcare professionals to have these conversations and to try and support people in a very person-centered way. But then also to think about how we engage with healthcare professionals to try and encourage them to embed physical activity into their routine care as well. And building on that, what we do know is that 1 in 4 have taken action to become more active after a conversation with their healthcare professional. So on the left-hand side, you can see that 41% of people with health conditions told us that they've had a conversation about being physically active with their healthcare professional, which is good. It's progress, but to me, that's still 60% more growth that we can achieve, especially given that we know that they're such trusted sources of physical activity. But the really big insight on the right-hand side is actually the impact of those conversations on physical activity. So when we asked then, okay, so you've had your conversation with your healthcare professional, did that then inspire you to take action as a result? And 1 in 4 people said that it inspired them to take action to become more physically active, which is huge. And when I've spoken to lifestyle medicine GPs who are practicing in this space, they said in comparison, the 1 in 4 for physical activity compared to smoking cessation and encouraging people to stop smoking is more like 1 in 100. So the power of these physical activity conversations can be huge. And I think the other thing to mention as well, just below that in the amber bar, it's also made 46% of people think about being more physically active as well. And in terms of encouraging that behavior change, that can be a really important and positive step. That person might not be ready to be physically active straight away after hearing some information and advice. But if they're starting to think about it, that can really then start that behavior change journey, and I call it planting a little seed to then be picked back up further down the line in potentially a future conversation. So moving on, what we wanted to share was some of the barriers that people with long-term health conditions have told us are the main barriers for them. And we're looking at the top 3 mostly here. And I guess the top one that comes through, and this isn't just from our Bridging the Gap report, this is from all of our campaign tracking, is that pain is always the top reported barrier for people living with long-term health conditions when we ask them about what prevents them from being physically active. A lack of energy, fatigue, or feeling too tired comes in next, and physical limitations that result directly from a person's long-term health condition as well. And you'll see some other ones there, like time, location and access at the very bottom there. Lack of money and cost was only 5% in the east of England, which is an interesting one. And I guess at this stage, what would be really interesting for everyone to think about, and you can pop it in the chat, is whether there's anything that surprises you. And does this align to what you hear in practice? Are people telling you that it's the pain that is preventing them from being physically active? Or I guess sometimes what we find in practice is that you hear something different that's more related to your role or way or at. But it's something to think about in terms of the barriers, because again, if we understand the lived experiences of people with health conditions, then hopefully we've got a better feel for how we can then support them in a person-centered way. So I guess one of the key hooks from the Bridging the Gap report was around the barriers that people face with long-term health conditions and those lived experience barriers. So what you can see there is what we've just shared on the previous slide, what people living with health conditions in the east of England are telling us are the main barriers. But we found that there's a bit of a gap and a bit of a mismatch in the understanding between what then the system or professionals across lots of different sectors then perceive are the barriers for people living with long-term health conditions. So as you can see on the left-hand side, we've got pain, physical limitations and lack of energy. But then when we looked at what professionals in the east of England think are the top barriers for people with health conditions, they mentioned things like a lack of money and cost at 28%, motivation and mindset at 26%, and a lack of time at 19%. And that's why we encourage you to think about what you're hearing in practice, because there might be some mismatches there. But I think as an overall, what we identified within the report is that there is a clear lack of understanding those lived experience barriers, potentially that people with health conditions are facing when it comes to physical activity, especially when some of these can be deep-rooted biases from professionals that may then discourage them from having conversations about physical activity with people with health conditions. So just to share a little bit of the verbatim responses that we had from this. So in the purple box, a person from the east of England who's living with a health condition said they have chronic pain, exhaustion, fatigue, low mood and poor sleep. So lots of this is directly linked to either pain or a person's long-term health condition itself. Whereas a healthcare professional from the east of England said it's more time and money. Also a lack of information and education. Even if they have all of these, willpower and motivation is an important determinant. So what we want to share here, we're not here to beat down professionals. We know that there's such fantastic practice, but what we do want to encourage people to do is reflect on that practice and to really try and think about those lived experience barriers that people living with long-term health conditions are facing. So moving on to the next one. When we look at another piece of insight that we were really keen to explore was how confident professionals feel in supporting people living with long-term health conditions to be active. And I think actually overall, all professional audience are pretty confident in supporting people to be active. If you look at the health and social care professionals there, sport and physical activity professionals, you'd expect to have a good understanding and confident in supporting people to be active. But what we did find is actually that family, friends and carers, who sometimes are actually the people who are closest to those living with long-term health conditions, they were the least confident audience. So you can see that 34% said that they're not very or not at all confident in supporting the people that they care for or that they live with to be more physically active. And this was a bit of an interesting gap for us to unearth. And the reason is that we know that across health and social care, for example, there's such fantastic training programs like physical activity clinical champions or the moving medicine resources that are designed for healthcare professionals to have these conversations to increase their confidence in supporting people to be active. But maybe there's a gap in actually those who are closest to them, those unpaid carers, their family members and friends that have a bit of a deep-rooted fear about making things worse. There was quite a lot of concern about, well, I don't want to encourage physical activity because I might make it worse, and having that confidence to do that. So this is something that hopefully in the next couple of months you'll see that we as a campaign are acting on. We're looking to develop a guide with Carers UK to support carers in their confidence in supporting the people who they care for to be physically active, but then also to encourage carers to be active themselves, because we know that, one, many of them live with long-term health conditions themselves, and two, carers are less likely to be active than non-carers too. So a really interesting one to think about, and there might be people within your networks in Hertfordshire who are carers or carers groups that may actually need a little bit more support in understanding some of these insights, but also some real practical ways that they can support the people they care for to be active too. And when we looked at sort of the resources that would then support that confidence and to make it a little bit better, I'm sorry, this is a bit of a busy slide, but we asked what would help you to be more confident supporting people with health conditions to be active. And the top ones that come through across both family, friends and carers and professionals was training and examples of support to provide. So we know, as we mentioned, for healthcare professionals, there's good training out there, but could we do more for different organisations and roles? One thing we found in the sport and physical activity sector is that potentially those fitness instructors or GP referral instructors, for example, are more likely to feel confident and knowledgeable in this area because they're qualified. But then you might have other people based at a leisure centre, for example, who are front of house or more administrative in their role, who aren't as confident in supporting people to be active. And it may not necessarily be their role to provide a training program, but actually having a knowledge and understanding of the needs of people with health conditions when it comes to physical activity could be a really important learning to share. Then there's also bits around knowing how to engage and motivate people. So things like motivational interviewing training come through there, and it's something that if there's resource to develop that and to support the workforce in motivational interviewing, that can be a really useful tool to then inspire and bring people along that behaviour change journey too. So just a couple of different bits there. There's some differences between the professional audiences and those sort of family, friends and carers as well. So professionals told us they're looking for more and easily accessible information and resources relating to this stuff, and hopefully that's where we as a campaign can support. And then what we also wanted to look at is the top ranked resource ideas that would support professionals from the East of England to then make it easier for them to support people with health conditions to be active. So we looked at this for different groups across the health and social care, charity and voluntary, sport and physical activity sector and government. And the reason we want to show this is because you can see that there's some real clear differences between the different audiences. And I think if you're, let's say, a decision maker in Hertfordshire and more strategically placed to support different organisations or different sectors to embed physical activity, then this can be really useful to know what makes that professional or what makes that organisation tick. So, for example, with health and social care professionals, we heard a lot more around printable assets that can be displayed in healthcare settings. Only yesterday, we had an email come through from GP practices in Bedfordshire, which were asking for videos and information from the campaign that they can put on their TV screens, and also printable resources to share with people with long-term health conditions as well. So something that's quite tangible that they can hand to somebody seems to be quite a key thing for healthcare professionals. Whereas when we looked at the sport and physical activity sector, they were looking for more things like this and things like today, I guess, such as more research and insights that makes the case for physical activity for people living with long-term health conditions, comms assets that can be tailored. So whether that's things like connecting with the campaign, that then you can tailor the We're Undefeatable message, but link it into local stories or local campaigns would be fantastic. And a way to connect with other professionals to better understand physical activity for health conditions as well. So across the sport and physical activity sector, there seems to be a lot more about that shared learning and supporting each other on that learning journey. So again, a really interesting one to take away, and hopefully that's something that will be quite a useful thing to share, especially if you're working alongside or supporting some of these professionals in Hertfordshire, there might be certain resources that can be developed to help them more. So I feel like I've been talking for a long time, and I've seen little bits going off in the chat. So that's the first bit of today's session, where we're looking at all of the Bridging the Gap insights from our latest report. But what I'd love to hear a little bit more about in the chat is there any initial thoughts and reflections on the insights? Is there anything that really relates to your role or the organisation that you work for? And I think that's something that's really important to reflect on. Is this something that you can do? Is there any insights that you can take away that means something to you from today, whether it's to support the work that you do in supporting people with health conditions to be active, or more something that you could share back with colleagues or wider organisations? And how could these insights be utilised in practice? So yeah, feel free to pop in the chat any thoughts. I'm seeing some really great stuff come into the chat, people sharing links around pain management, so thank you for that. Charlotte's saying that they're looking at running motivational interviewing training for members of the Live Longer Better in Hertfordshire network. That's fantastic. I did that a couple of years ago. That was it was a really great way of increasing my skills in this space to better support people to be active. Someone else is saying I'm working for a charity and we're offering awareness courses. Are there any short introductory courses for the affected people and the carers that are available? So yeah, that's a really good question, actually. I would say certainly have a look at the Moving Medicine website. Even though it's designed for healthcare professionals, there's plenty on there that can be useful and can be taken away in lots of different sectors. But also, hopefully for carers, we have been pulling together this new guide and pack with Carers UK that might be a real tangible resource that can help support people, to support carers to have greater confidence in physical activity and long-term conditions, but then also to inspire them too. And I know that Charlotte's following up in the chat, and I'd be happy to have any conversations with organisations or through another session that might then share some of this learning on further. So yeah, as we go through, please think about any of these insights and what stood out for you. But what I'll do, I'll move on to the next bit, which is basically... Oh, Charlotte, you got your hand up. Lovely.
Yeah, sorry, Peter. I just was thinking of a couple of bits that I think relate. So I think we're pretty good in Hertfordshire in terms of doing lots of stuff for Parkinson's. At least that's what I'm aware of. I feel like we're very strong on that, and we've got Everyone Active, who nationally offer free memberships, people living with Parkinson's, and we've also just today actually launched a local instructor, I'm trying to think of the word, like educator, has just released a exercise for people with Parkinson's online qualification, and that's for anyone. It doesn't have to be Hertfordshire, but he's just done that, and it's £25 per person to do it. The idea is that it's as accessible as possible. It's online modules, like what do you need to consider if you're working with someone with Parkinson's. And I feel like we've got a good number of resources there, and that individual, John Molyneux, he's also created an exercise guide for living with Parkinson's, and we've been able to do a nice little roadshow of some of the Parkinson's supports group and things to get it out there. But there's definitely areas that we need to do even more work in, and especially the pain, like pain being the number one barrier for people. That's something that we need to get more awareness out there for people living with pain. And like you say, the family and carers, like that's maybe we should do, especially when you guys release your stuff, but I think we should definitely do a campaign aimed at families and carers, because often that's who we're reaching when we're on social media as well. So maybe that's going to be really helpful for us. And then the final thing, sorry to interrupt you, but the final thing that I thought was the Good Boost programme that some people may or may not be aware of. As I understand it, that's the Hertfordshire-based pain management physical activity programme. So pain, it's I think in partnership with Everyone Active, and there's a few Everyone Active sites in Hertfordshire that do the Good Boost exercise sessions. So I'll see if I can find a link to that and put that in the chat, because that might be a really useful one for people to signpost to and take advantage of. So thank you for sharing those key highlights. I think it's really useful to know which direction we should go in.
That's fantastic. And I think that you've just explained there, Charlotte, is exactly what we want to advocate everybody to do, is just think about what can we do about this, or how can we do this in Hertfordshire? And it sounds like there's great pockets of work for particular conditions. We would always advocate for multiple conditions, because there's many people living with more than one long-term health condition. And yeah, we've heard lots of great stuff around the success of Good Boost, and I think they've got a water-based program, but then also a land-based. Not sure around the wording about land-based, but basically out of the pool programs as well. So yeah, definitely take a look, and it sounds like there's lots of great stuff going on. And it's just thinking about where can we then provide more support, where can we then have another impact, and if that's doing something around pain, or if that's doing something for carers and family members and friends, then that would be really great, because we've identified that there's gaps in this understanding and confidence that we can then maybe support them more. So yeah, I guess from that we looked at then how can we Undefeatable support. So if you've got your phones, please get them out and scan the QR code. We've just relaunched our new campaign website for people living with long-term health conditions, but as part of that we've also relaunched our campaign hub, which is designed specifically for professionals and has lots of resources, assets for professionals that they can utilize and embed within their practice. As I said, they're ready-made, they're all developed in partnership with our charity partners, so hopefully they're a really trusted source of information and advice. And yeah, we've got lots of insights and research. We've got case studies from other professionals and organizations sharing how they have embedded We're Undefeatable into their work. There's lots around supporting the workforce to understand the needs of people with long-term health conditions, which is something we identified in the research. Comms and marketing guidance, as I mentioned, there's lots of ready-made assets, whether it's imagery, videos, or campaign messaging and tone of voice. We really want to advocate for people to follow a similar way of talking about physical activity and movement to the campaign, because we know that it works and we know that it resonates. Even things like National Fitness Day, it's a fantastic hook, but maybe a National Movement Day in future might be a better hook for this audience in particular. I don't know. I'm not on the plan to change all of that, but things like that could make it more accessible for this target audience. So yeah, please take a look. It's a really good place to start, and I'll talk a little bit more depth about our resources shortly. Right now, actually. There you go. That was a good setup, wasn't it? So first of all, as I mentioned, we've got our new campaign website. I guess some of the big differences and big changes that we've had from the campaign website is that it's all been reimagined and reworked and developed with people with lived experience. So last summer, we had lots of people living with health conditions who were going through the user journeys, going through the old website and telling us what works, what doesn't work, what kind of things they expected to see. And I guess the idea of our campaign website is that it can be a bit of a space, a bit of a one-stop shop for people living with long-term health conditions to find information about getting started on their physical activity journey, or finding inspiration on ways to move through our storytellers, for example. We've got a new quiz, which hopefully is all about personalizing the journey for somebody. So it's a 2-minute quiz that then pops out some ideas at the end, which could be really useful and is a bit more tailored and personalized. We've got new health condition pages, because we had lots of people with lived experience telling us, actually, we want to hear a little bit more about the condition that I live with, not just generic content as well. So our charity partners, we've been working really closely with them to develop that. So please do take a look. Please signpost people to the campaign website as a starting point, but certainly have a look at our campaign hub for professionals as well, because there's probably lots in there that you can explore. Give yourself half an hour one afternoon, usually on a Friday when it's a bit quieter, and have a little mooch around the campaign hub. That's what I would say. And then what I did want to share is one of our new resources. And I guess on here we've got resources for older people, but this is for any person living with a long-term health condition. But we wanted to bring this in because it's part of Live Longer Better in Hertfordshire as this masterclass. And you may have seen that we've just launched our new SOFA campaign. So SOFA stands for the Sit On Fitness Apparatus. So the idea behind this campaign was all about inspiring people that they can move more from the comfort of their own home, and in particular, the comfort of their own sofa. So we've got a new PR campaign by the fantastic Bill Bailey, which I'll play next. But also there's a new resource as well, which we've designed some sofa-based movements that people can do at home that could be really accessible and hopefully can be suitable for beginners and people living with a range of long-term health conditions. So I'll let Bill tell you more. There you go. So there's no better person to talk through it than Bill. Oh, thank you for that reaction there, Charlotte. Yeah, I guess the idea is this is a PR campaign, and the idea is to inspire people to be active and to really just change the narrative that you can be active from home, and there's lots that you can do that, especially for people living with long-term health conditions, could be a really good starting point for them. It's had lots of good press coverage. He's been on Lorraine recently talking about the campaign and trying to inspire people to be active, and that's all part of it. But there is also this resource, so please do take a look at the resource and share it with your networks, get it out there. People love Bill, so he's been great for us as an ambassador. And in a similar vein, we've got our 5 and 5 resource, which is all about building a 5-minute mini workout that people can do from home as well. So you do 5 movements. Each one is for 1 minute. That adds up to 5 minutes. And again, there's an online resource, but also a printable resource that, again, can be utilized just to share for people, maybe to be active at home. And I think where we see this being really useful for local organizations or professionals is that people might be coming to your sessions in a community space, but they might also be looking for some things that they can do between their once or twice a week activity as well, or something that they can do whilst watching. I don't know why Songs of Praise come into my head, but it did. Songs of Praise on a Sunday morning. They might want to do a sofa workout or a 5 and 5 workout, and each little bit, it's all about gradually building up physical activity, and hopefully some of these resources can help you to do that, whether you're watching Songs of Praise or not. The campaign's also got lots of follow-along workouts. So last year we did another campaign with Bill Bailey called Freedom to Move, which we designed a kitchen routine using tins of beans and that kind of stuff, a bedroom routine, and also a garden or a routine that you can do outside of your home as well. We've also launched follow-along workouts with Gok1 in the past, which all looked at how you feel and moving to your mood. So we had one when you need a boost, if you're feeling energized, or even if you are relaxed and just want to do a gentle movement that day. And then these are all about 5 minutes long. So again, can be really accessible. They can be seated or standing. So really good for beginners. But then also we've got your Make Your Move videos as well, which are a little bit longer in duration and focus on different activities such as strength or balance or energy, whatever that may be. So again, take a look at the We're Undefeatable website. There's lots on there. We've found this actually work quite well across care homes in local places where people are looking to do 5 or 10 minutes of activity with their residents each day, and they've been able to play some of these videos, and because they're fun, they've got recognizable faces, they can be quite nice ways to do it. And then what I wanted to talk about as well is a little bit around localizing We're Undefeatable, and I guess how you can get involved with the movement. We've done a fantastic partnership with Charlotte and team at Heart Sport and Physical Activity Partnership previously, where this We're Undefeatable in Hertfordshire was launched, and that's exactly what the campaign is all about. We want you to own the campaign. We want you to connect with the message, connect with all of the different bits of insights or assets or research that we've talked about today, because we know that it could make a difference in your place or space. So what I wanted to talk through was just some ideas of how you can get involved with the campaign in Hertfordshire. So I guess number one is embedding and signposting to the campaign as a universal physical activity offer within your services and programs. We've heard recently that people are looking to embed the campaign across health pathways and physical activity pathways, potentially when people are on waiting lists to join a service or to see a healthcare professional. We've even got people who are adding this to their GP referral offer because they know that it can add that benefit about being active when they're not with them at their leisure or community space too. We're really passionate about encouraging local organisations to create their own We Are Undefeatable stories and to really shine a light on the great work that you do, but then also to have these relatable stories of people from Hertfordshire that can then inspire other people with health conditions in Hertfordshire to be active as well. And we're not expecting something fancy like Bill Bailey's video there or Christine's video, but there's lots that you can do with even just taking a picture on the phone, adding the Proudly Supporting logo, which you can see in the bottom right corner, or connecting it in with We're Undefeatable in Hertfordshire and joining that movement. We as a campaign love to share these stories. We love to engage with them. So you are likely, if you're delivering physical activity programs and services, to have in the back of your mind someone fantastic who would make a wonderful We're Undefeatable story. And unfortunately, we can't make one for every single person like that, but we would encourage you to think about creating your own and joining that movement. And as part of that, you can align with the campaign's message and tone of voice that we talked about earlier, and all of the assets that can be found on the campaign hub. We also, as we've probably done a little bit today and touched upon today, there's also opportunity to support the workforce to better understand the needs of people with health conditions through our insight and research. Now, we're not saying today is like a CPD training qualification, but what we want to do is share the insights. So then hopefully you can reflect on what that means for you and your role and how you can better support people with health conditions in the work that you do. But sometimes on these webinars or in these kind of networks and groups, we're sort of preaching to the converted a little bit. And actually, there might be wider networks or wider workforce colleagues and contacts that may benefit from understanding the needs of physical activity for people with long-term health conditions, because it then might help them to support people better, even if it's just having an awareness of some of the resources that they could use or some community assets from all the great work and programs and services across Hertfordshire. That might go a long way then in better supporting people. And I guess just as an open offer, please do feel free to get in touch with us if you're thinking about, well, how can I localize the campaign, or how can I connect with it better? I've left my email on there, but also our We're Undefeatable sort of generic email as well. And there might be something that lots of people want to do across Hertfordshire and might make us think about doing something together, like Charlotte touched upon. When the Carers Guide launches, could we look to do a campaign and reach those networks together, or could we look at some pain-specific messaging that could go out across Hertfordshire? Some already great ideas that are coming through. So before we move to some questions and answers, I guess what I'd love for everybody to do is, I don't know if you've used Mentimeter before, but it would be great if you could share what your main takeaways are from today, and if you would like to make a pledge as well to how you will support people living with long-term health conditions in Hertfordshire to move more. That could be based on today's insights, or it might be something that you're already doing. But it'd be great if you can have a little look at that on the Mentimeter, share any of your key takeaways, thoughts and reflections, or even in the chat function now. I don't mind where it goes or where it lands, but it'd be fantastic to get your thoughts and what's been quite important for you today. So what I'll do, I'll try and find the link so I can pop that in the chat as well. Or you can go to menti.com and put that code in 7950722. So yeah, that's it in terms of the content for today, in terms of going through the insights and I guess where we're Undefeatable can support. But what we are really keen to do is to answer any questions that you might have. I don't know if anything's been coming in the Q&A at all, Charlotte, or if there's anything that's come through the chat, because I haven't managed to fully look through it all as we've been going through.
No, that's fine, Peter. Nothing in the Q&A, but a few points in the chat. So someone who I think is in the community has said awareness and motivation is absolutely key. So thank you for the links and further information. I think what you said, Peter, about setting aside half an hour to go through all the resources is a really good idea. And just whilst you were showing the sofa campaign, I was like, oh my goodness, I definitely need to share this. So I've gone on We're Undefeatable's LinkedIn page as well. So if anyone's got LinkedIn or wants to go and follow them on LinkedIn, and it's on there. And also, which is new to me, and I feel terrible about it, but September is Pain Awareness Month, and you guys have just done a post and a video about that. So I feel like as an easy thing that we could do is share the stuff that you guys put out, because it's so beautifully created, isn't it? And it's a really useful one for us to put into the community and put in our newsletters and things. Someone has said we have a Movement Monday afternoon class, and we'll definitely use the resources from today to encourage service users to keep moving. That's music to our ears. Thank you. And I think it's really nice because if we can reach care providers and groups like that, or age UK groups and things, it can really help get the people who are not yet taking part feel a little bit reassured about the benefits, or not necessarily the benefits, because like I said, everyone knows the benefits, but that actually taking part isn't going to make them feel worse, and the pain and management and things like that. So those pain resources are really useful. Thank you, Peter, about the exercises being able to be downloaded and printed. If you guys need us to print anything for you, if you have trouble with printing, Heart Sports Partnership would be happy to help with that. So drop me a message. But yeah, like Peter said, they're really accessible, aren't they, from the resource hub?
Yeah, I think and some of them can be professionally printed as well. If you see value in not just having it on a piece of paper, you can take them to local printers, usually at quite a cheap cost, and they can be rolled out. As I mentioned, we've heard lots of people rolling out these resources across different places and using them in really innovative ways. That is always exciting for us to hear as well. And I think that's another thing. Please do join the movement if you use some of the resources and you found them useful. Let us know how you've been doing it, because sometimes we share this stuff but don't hear back where it's being used and how it's being used, and that's a really important for us as well.
And that's really great. So if I just share a tiny little bit from HSP point of view that might be useful, is go through those ones. Moving More might be a useful tool for people to use in terms of getting people active who are living with long-term health conditions. So it's the online activity finder. Essentially, you can put in a postcode and it tells you what's happening nearby, and there are filters where you can put in you can say that someone's got physical disability as well, which might be useful. And there is a Moving More at Home section, and we link through to the We're Undefeatable campaign information on there as well. And we also have a professional section on there which has got lots. So as Peter mentioned at the beginning, We're Undefeatable is a group of 17 different charities that all specialise in their different long-term health conditions. So we on the professionals page, we've got links to the different resources relating to those different long-term health conditions, so you can get really specific on there, specific advice, and there's an app for that too. And then we've got a post-webinar feedback form, which I'd be really grateful if people could fill that in. And the takeaways, Peter, if you're able to share those with us, that'd be really lovely. I do believe that you can actually click on the slide. So as a viewer, you can actually click on the slide and click through to that link. And I thought I'd just mention our next webinar for those who are interested is on the International Day of Older Persons, which is the 1st of October. So that's kind of an introduction to Live Longer Better values. And we're launching age-friendly communities in Hertfordshire. And I know that Natalie and Joe, who are working on that, will be really keen to hear the We're Undefeatable stuff that's going on at the moment, because that's a real key part of living well, is being able to live well with your health conditions and be supported by the people around you. So I think it aligns really nicely. So if anyone's interested in our 1st of October webinar, then you can sign up through the link on the slide. Thank you all for coming. Thank you so much, Peter, for that really useful information. And we'll share the slides as a PDF afterwards. And then everyone can have access to the really useful resources.
Super. Well, thank you for having me. It's been great to talk through, and look forward to seeing more of you join the We're Undefeatable movement.
Yeah, no, that's brilliant. Thank you so much, Peter. Really appreciate it. Thank you, everyone, for coming. We'll hang about for a couple of minutes, Peter and I, in case anyone's got questions. But other than that, I will bid you a lovely afternoon and hopefully see you all soon.